Welcome back. You are watching Breakfast with Charlie and Louise.
Time now is 8:34. It can be a very nerve-wracking and exciting moment for expectant parents. Going for an ultrasound can also be the time when you get some difficult news.
Now, new guidance is being issued to sonographers to make sure that everything is communicated in the best way possible, especially if there are pregnancy complications. Breakfast Tim Muffet has been speaking to some parents about their experience.
Right at the very end, she said, "So everything looks fine. Your baby's got a heartbeat, and there's just no fluid around your baby." And that was almost said in passing. You know, I can still hear those words clear as day.
Hannah has had several miscarriages. On more than one occasion, distressing situations were handled badly.
I remember just feeling the colour, the blood colour draining out of my face, and I felt quite faint. And he said, "So if you can just sit in the waiting room and we'll send a doctor out to talk to you." And she looked at me and said, "What's wrong with you?" And I just had the shock of my life, actually, that, yeah, you've just given me this news. And I'm trying to comprehend it, but also now I have to go sit back in a waiting area full of other expectant parents.
Now a mum of 5, Hannah welcomes new official guidance for sonographers who carry out scans on pregnant women.
It seems to me to be sort of basic principles of good care, and it's not been present.
Around 1 in 20 baby scans pick up anomalies that could indicate a health condition. Some are serious, some aren't. It's down to sonographers, such as Alexandra, to relay unexpected news.
And what we're trying to do as sonographers is, whilst we're scanning in real time, quite often with the parents asking us questions like, can we see what the gender of the baby is, and is that the baby winking or is it the heart flickering? We're trying to think, you know, how are we going to break the bad news? Have I actually diagnosed what's wrong with the baby correctly? And so it's a very, very stressful situation to be in. And then suddenly you have to turn to the patients and sort of shatter their world, really. A lot of the training that we get is in-house. So it's literally watching the sonographer that is your mentor and who you're learning from. And obviously that's reliant on the sonographer doing it correctly in the first place. But we've never had a go-to publication, something where there is a consensus on how we should break bad news.
The new guidance is published today. Dr. Judith Johnson led the research.
It's important that sonographers are honest and they provide a balanced picture of what they have seen, even if this is uncertain. And linked with that, neutral terms are really important. So it's important that sonographers use the term chance instead of risk, and health condition rather than abnormality. The use of the word baby. What we now know is that it's always a baby. As soon as expectant parents know that they're pregnant with a baby. And it's really important that sonographers use that language too.
Zoe is 13. She has Down syndrome and was born with a heart defect.
Whenever you hear news like that, we describe it as like being hit by a juggernaut. We were the classic first-time parents going to our 20-week pregnancy scan, expecting to find out whether we're having a boy or a girl, grandparents on hold on phone and all that sort of thing. So I don't think there's any good way that you can possibly hear news like the news that we heard. However, I think it is possible to give that news in a sensitive and in a compassionate way. And that's pretty much what happened with our experience. The sonographer was very compassionate. She responded to the questions we were asking. She was very honest. She told us what she thought she could see, but didn't try to overtell us things, didn't try to diagnose.
John runs a charity called Tiny Tickers for children like Zoe who are born with heart problems. He helped draw up the new guidance.
I think it's absolutely vital that this training and these guidelines are adopted, because sonographers have been asked to do a really, really difficult thing here. Up until now, there's been no consensus guidelines. There's been no mandatory training for sonographers. So they've kind of been really left to it to pick their own way through that really difficult thing.
Zoe's life got off to a difficult start, but John and his wife are grateful that they were told sensitively and honestly about the challenges that lay ahead. Tim Muffet, BBC News.
Well, let's talk a little bit about all of this right now with Lydia Boyd, a volunteer at the Miscarriage Association, also Jill Harrison, a sonographer who was involved in drawing up these guidelines. Thank you so much for joining us, both of you. And in some ways, it's such an exciting time for parents, but such a sort of nerve-wracking time as well, and really can be very difficult. Lydia, you've had your own experience, haven't you? Just tell us a little bit about what happened.
Yes, so we had a miscarriage in February of 2017. prior to kind of finding out that that was what was happening, I started bleeding, and we were told, we don't know whether this is normal bleeding, abnormal bleeding, but we'll give you a scan and find out there. And the ultrasound that we had and the sonographer, it was fairly devastating because we found out that it was a miscarriage, but the way in which that information was communicated to us, it was really hard for us to then kind of go away and feel something about what we'd been told, because the sonographer basically questioned us. So what I mean by that is, we went into the scan, they started scanning, and they said, how many weeks do you think you are? And by my dates, I was 11.5 weeks. And the sonographer said, well, this gestational sac is only 8 weeks and your baby actually isn't there. So that was kind of how we found out that we'd lost our baby that we'd been dreaming about for 11.5 weeks. So coming away from that appointment, my husband and I were in shock, but also found it really hard to start processing that loss and feel validated in processing the loss of our child. And the language that was used was very clinical, as we've heard. And yeah, so that's kind of briefly what we experienced.
Well, Lydia, what you describe, you know, people are literally walking it through with you. So you walk out of that consultation, and I think the words you've used is you turn to each other and you ask each other, what just happened then?
Yeah, exactly. It is that shock. It's the kind of, okay, so we've lost our child, yet how this has been kind of communicated to us almost makes you feel like, well, I've not calculated this right, or there's something here that isn't quite right that I've done, or yeah, and just there was sort of very little compassion, or I'm sorry you're going through this. It was very clinical. And coming from working from the NHS myself, I understand the pressures and the stresses on clinicians and burnout and all of that, and the impact that can have on your ability to have that bedside manner and the compassion. However, the humanness there just wasn't, and yeah, it kind of made that process a little bit trickier for us, I'd say.
I'm sure what you're saying will resonate with lots of people, and of course there is bad news delivered in different ways. Jill Harrison, though, how important is it that the language around this is thought about? And I know you're part of drawing up these guidelines. Jill, can you hear me? You're part of drawing up these guidelines. How important is the language? I'm so sorry, Jill doesn't be able to hear me, but I'm going to try one more time. Jill, I know you're part of drawing up these guidelines. How important is language?
Absolutely crucial. We've got to be so careful what we say, because everything that we say to a parent will be remembered. The very first words we say are the ones that stay with them forever.
So what kind of things, I mean, you know, because they're doing a difficult job, sonographers, so what kind of things are you trying to make them change?
More about thinking about what the parents want in terms of terminology. So like Dr. Johnson said, using the term baby, because this is a wanted pregnancy for most people. If parents are using the term baby, then we should be using that. And the only time we would say to use the term fetus or pregnancy is if that's the terminology that parents are using. And the same thing with risk and chance in terms of Down syndrome screening. It's not a risk, it's a chance of having Down syndrome. For some parents, it's very, very different.
It's really interesting hearing both of you. And Lydia, just in relation to that, we all know NHS staff, and you said this yourself, are under enormous pressure. The truth is, of course, when you're in that situation, it's not even just the words, is it? You're probably looking at the expression on the face of the person, just trying to read anything. It's the moment you walk into the room.
Yeah, you're right. And, you know, it's the silence of when the scan is happening and you're kind of searching the screen, looking for what you think might be a positive sign, or and then, yeah, like we've heard, it's those first words that are so important and that stick with you, and the language that's used referring to your baby as a baby. I think I've had kind of my babies referred to as contents of my uterus before, and it's just kind of putting yourself in the perspective of the patient that you're working with and having that compassion. And I'm not saying that sonographers don't, I'm sure a lot do, but I guess under pressure and that kind of thing, it could be getting the job done rather than seeing the person as a human.
Lydia, thank you so much for sharing your experiences with us this morning. Jill Harrison,
thank you.
From Professional Office for Ultrasound, thank you for your time this morning as well. Apologies for one or two of the communications problems a little earlier on. Thank you.
Yeah, I'm sure, as I say, some of those things that she was saying will resonate with lots of people watching this morning.